This is Cosmident, an AI exam platform for ORE and LDS Part 2. Here's a live demo. The candidate is straight into a timed station. This one's written, grade this patient's malocclusion. There's nothing to pick from. You type your reasoning in your own words, and answers seal the moment the clock runs out. Next, a prescribing case, pericoronitis. Is an antibiotic justified? Name the drug, the dose, the duration, and the management plan. Now, something a written paper can't do. A surgical extraction, and the student draws the flap design directly onto the tooth on screen, then names each instrument. What raises the flap, what retracts it, the suture, the forceps. You're planning the procedure, not ticking boxes. Next, real radiographs. 2 bite wings from a high caries risk patient. The student boxes each carious lesion straight on the film, zooming, inverting, adjusting the contrast to read the interproximal surfaces, then decides which to treat, which to watch, and the recall interval to set. Then a periodontal station, a basic periodontal examination. The student reads the probing findings and records the correct BPE code for each sextant and links it to the patient's risk. One more skills station, matching each patient's history to the correct radiograph. Fast, visual, and marked the instant you submit. Now it gets real. This is what nothing else offers. A spoken consultation with an AI patient who talks back. The student just speaks, hands-free.
Hello,
Listen.
I'm Dr. Smith. I understand you're having trouble with one of your teeth. Can you tell me more about the pain you're experiencing?
I've had a few episodes of really bad pain and infection around my lower right wisdom tooth, doctor.
I'm sorry to hear that. How often are these episodes occurring? And are you having any swelling or difficulty opening your mouth?
Yeah, my cheek gets swollen and it's hard to open my mouth when it's infected. It's really uncomfortable.
I understand how uncomfortable that swelling and limited movement must be. To get a clearer picture of what's happening, we should take a look at an X-ray.
I actually brought the X-ray with me. It's an OPG. I was told to bring it along.
And the case comes with real evidence, mid-consult, an OPG, and blood results with the glucose flagged high. The student reads it live and explains it back to her.
Yes, I have type 2 diabetes, doctor. And to be honest, I'm a bit worried about how it might affect the healing process if I need to have the tooth taken out.
Your concerns are valid. High blood sugar levels, as shown by the HbA1c and fasting glucose results, can impact the healing process and increase the risk of infection after an extraction. It's important to work with your doctor to get your blood glucose levels under better control before any surgical procedure.
That makes sense. I guess I need to get my sugar levels under control before we can do anything about the tooth. But what about the tooth? Does it need to come out, doctor?
Given the recurrent pain, infections, and the position of your wisdom tooth, extraction is likely necessary once your blood sugar levels are stable. This is not likely.
Then, the Viva, a different AI examiner. Rapid-fire questions out loud, nothing shown on screen. The highest pressure part of the exam. A 30-year-old collapses minutes after taking amoxicillin. They have facial swelling, a widespread rash, and are wheezing. What is your immediate diagnosis?
Anaphylaxis.
All right. What is the first drug you would give, and its exact dose and route?
Adrenaline, 0.5 milligrams intramuscularly, 1 to 1,000 concentration.
Okay, how would you position this patient?
Lay the patient flat with their legs elevated.
Noted. What would you do for their airway and breathing?
Administer high-flow oxygen and inhaled bronchodilators for wheezing.
Right. Who do you call and when?
Call emergency medical services immediately as soon as anaphylaxis is suspected.
Thank you. After 5 minutes, there is no improvement. What do you do next, and what do you monitor?
Repeat the adrenaline dose and monitor blood pressure, heart rate, and oxygen levels.
Route of repeated dose?
Repeat every 5 minutes if there is no clinical emergency.
This is the DTP, the long case, played out over 4 timed phases, exactly like managing a real patient. It opens with the history, presenting complaint, medical history, medications. The student builds the picture in their own words. Then, examination and diagnosis. And notice, the history phase locks behind them, still there to read but no longer changeable. Once a phase is done, it's done. As they progress, new results are released. Here, the vitality tests come back. The case evolves and they plan the treatment around what they now know. Finally, they present the plan to the patient and finish. History, diagnosis, plan, presentation. One continuous clinical case on the clock. The moment it ends, everything is marked. Instantly. This is the report. A full mark sheet, every criterion correct or missed. And it shows it's working. It quotes exactly what the student said, then gives the model answer that would have earned the mark. No vague score, no waiting weeks. You leave knowing precisely what to fix and how. And nothing here is fixed. Any question can be edited, the task, live. The whole setup is open, the timings, the marking key, even the pass rule. Tutors can build their own stations and tune the rubric around their students. And behind it all, a human layer. Every completed attempt can go to a real examiner. This is their portal, a queue of finished attempts, each waiting for review. They open one and see the AI's mark sheet for reference, the full transcript, and give their own verdict. Pass, borderline, or fail, station by station, in their own words. Then their overall analysis and the priorities to fix. One click and it reaches the student. The AI does the volume. A clinician keeps the final word. Unlimited practice, real spoken stations, instant honest feedback, and a real examiner behind it all. Private and secure. Built for ORE and LDS. Part 2. Cosmident. Walk-in ready.